Well, good afternoon, everybody. Now, I was going to say evening for some reason, but it's not quite evening when it's bright out. So, we do have the honor of speaking to an amazing amount of wonderful guests to bring great information to the people that are with us and watching and listening to the show. And today, extra special, we have Dr. Esther Han with us from Orlando Health, urologist. How are you today?
Doing well. How are you, Keith?
Doing great. It's middle of the week-ish, kind of getting hot, I guess.
Hump day, right?
Yeah, it is that for sure. How was your day generally?
It was pretty good. Started off in the operating room and ended up here. So happy.
You're busy. That's a good thing. That's a good thing. I know it seemed like I was talking to a different guest earlier in the day, and I thought, my gosh, seemed like it was Christmas, then it was January, and then it was 90.
That's a fairly accurate statement.
Pretty much.
We got a little bit of cool weather, and I think last weekend, or was it the weekend before? It felt
That's
great.
true. Yeah, actually, the beginning of this week was a little bit cooler, so kind of nice.
True. Yeah, I was loving it.
Yeah.
Our nanny is from Venezuela. She's like, "Oh, it's cold." I'm like, "No, it's great."
Yeah. Well, in about a month, we'll have almost no memory of that whatsoever. So, we've got a few people popping on, so let's go ahead and let's go ahead and make this official, and then we'll do the real introduction and have some talk. Cool. All right. Well, again, the official welcome right now. I'm with Dr. Esther Han, urologist from Orlando Health, Dr. P. Phillips Hospital, and we are super excited that you are here. I'm going to give you the whole intro lowdown, but so subspecializing in female pelvic medicine and reconstructive surgery. So big title, lots of responsibilities. So honestly, thank you for taking time. I know it's to have providers from Orlando Health, we consider it to be a huge honor because we know you're super busy, and so to be able to figure out a time how we can invite you and make it with us is great. And the great thing about it is it's a win for the audience because they get to really understand topics that they just might not have an opportunity to hear about, learn about, and relate to. So I guess just kick it off, kind of maybe if you wouldn't mind, give us kind of a background. From where you came and maybe some of your schooling, how you landed in Orlando and with Orlando Health.
Sounds good. Thank you so much for having me, Keith. And so really, I'm a Texas girl. I was born in Texas, went to med school in Texas, then did all of my training up in Michigan. So I am a urologist by training. So I do see males and females, but then I went on and completed a fellowship in female pelvic medicine and reconstructive surgery, as you mentioned. So essentially, I do like to focus on voiding dysfunctions as well as any kind of reconstruction when it comes to the female genital urinary tract. And so I was brought down to Orlando by my husband. He is a Caribbean man, and he was no longer loving the Michigan winters. So this is actually just my second year in Orlando, first time living in Florida, and so far we're loving it.
So you mentioned Michigan. I am originally many years ago from the upstate New York area, and we had relatives in Royal Oak, Michigan, and
that's where I moved from.
Really?
Yep.
So the Windsor Tunnel is and all that, right?
Oh yeah, I accidentally went on that a few times when I first moved there.
It's kind of scary a little, actually.
I think they take away some of the barricades now because there's so many people who accidentally end up going to Canada.
I know, right?
You turn here.
It's beautiful there, though.
It is.
For like 3 months.
When I moved there, because a lot of Michiganders don't leave, and I'm like, what is with this state? And then you realize, it's beautiful, especially up north, and everybody has a house up north. So
it is. It's lovely, but we only go up that way pretty much between June and maybe October, and we're back.
You're smart. The winters are long and brutal.
So how'd you find yourself at Orlando Health?
Yeah, So actually, when I was looking for jobs, I actually came across, I met one of my colleagues, Dr. Jackie Hamilton, and she does female pelvic reconstruction as well here with Orlando Health. And she, you can say, recruited me. She was like, I need help, come on over. And so we are partners here, and it works out really well.
Well, we're super glad you're here for sure. It's a blessing for us. So let's go right at it. So as far as urinary incontinence with women, of course. So what are the symptoms, and how do people react to that? How do they reach out to healthcare institutions to say, when do they know I better reach out to a healthcare provider? Why don't you give us that whole scenario for people who might be listening?
Yeah, so for urinary incontinence, it can happen in both men and women. Generally speaking, for men, it happens after some sort of surgery. Say they had a prostatectomy for prostate cancer, or some sort of surgery to remove the prostate, whether cancerous or not. For women, we have a lot of different ways of showing incontinence. So my ladies out there who leak, they generally know. They usually have to wear a pad for either just in case, or they have to, or else they would have to change their underwear. So there's stress incontinence, which is essentially for all of my ladies who come in saying, every time I run or I pick up my kid, or I cough or sneeze, I got to cross my legs a little bit. That's stress incontinence. So anytime you have an increased pressure in the abdomen, that basically translates into an increased pressure in your bladder, and basically you leak a little bit. There's also urge incontinence. So those are my ladies who are like, I know where all the bathrooms are whenever I go anywhere. I can't go on a car ride for more than an hour or two, because I'll have to pull over. Door on the handle when you're going in the house and you're like, I got to run for the bathroom. That's urge. So that's the frequency of urination, the urgency of the urination. Even nighttime, sometimes women are saying, oh man, I can't get sleep at all. And men as well, because I'm waking up every hour, every 2 hours having to go to the bathroom. So that's a different type of incontinence. Essentially, that has more to do with your bladder being a little hyper, if you will, being overactive, hence the terminology overactive bladder.
So when you're speaking to patients, do they share with you how long they've been dealing with that, and do you find it to be, probably not because of the position you hold, but is it somewhat is it distressing or shocking how long they might keep that to themselves? I know women tend to, for me, I think I can say this because in my life, women are very strong. They can seemingly put up with pain more than a man does. And I mean, it's not, it's just kind of a generality, but when you see that, do you see that, contributing to how long they deal with this?
Absolutely. I mean, women are the caretakers the majority of time in the family. So it does take a lot for them to bring themselves to the physician. Oftentimes they're looking after their kids, bringing the kids to the doctor, telling the husband they got to go, mom and dad, So it's always, they usually don't prioritize their health, especially when it's something they can supposedly live with, or something that they may or may not see as a variance of normal. So oftentimes a lot of my women come in and they've had it for years. I mean, if they really look back, it was after the birth of their second child, and their child is, 22 now. So essentially, it's something that they've always just went out and just bought pads, something that they could have put a Band-Aid on for a long time, and then slowly realized that it's affecting their quality of life.
Right.
That sometimes I have to speak to women and they're just like, oh, it's fine. It's okay. And, I'm always one, I don't push anything. What I famously say is, if it doesn't bother you, it doesn't bother me. But
Right.
if it starts bothering you and you start thinking about it, it's probably time for us to talk about a treatment option.
So speaking of treatment, I've got to believe maybe that's evolved and certainly progressed. And how do you treat the treatment decisions you make? I'm assuming much different now.
Yeah, so we always have technology evolving the treatment options we have in medicine. The first thing we always do is tease out whether it's, like I said, the stress incontinence or the urge incontinence that bothers you the most. Most of the time, people have both, and we call it mixed urinary incontinence. However, the treatment options are very, very different. And so essentially, for stress incontinence, what I always do is explain to my patients, it has more to do with the support around your urethra. So if you have my fist as the bladder, you have the urethra. Prior to babies, you had a nice strong pelvic floor. So every time you coughed or sneezed, there was a nice strong backboard. So we can always start with referring you to physical therapy where they can strengthen that pelvic floor for you so you don't leak with that coughing, sneezing. If that doesn't work, or some of my women are just like, yeah, that's great and all, but I don't have time for this, and I'm just not going to do it.
Right.
And I appreciate the honesty. If that doesn't work, we have actually something that's really quite new right now, and that's a different type of urethral bulking agent, which is actually almost 98% water. And that makes it very different from previous bulking agents, which were particulate and it caused fibrosis and basically scar tissue in the urethra. So we go in, it's an in-office procedure. I put some local anesthetic around the urethra, and I basically kind of, if this is the whole of the urethra, we kind of close it down with these cushions of water to prevent leakage every time you cough or sneeze. The best part is that you have 24 hours where I tell you no sex, no exercise, and then you're back to normal.
Right.
So speaking of women, where they always take care of their family, they really don't want that downtime if they have surgery. When I talk to them about slings, which is still very gold standard, I tell them, 4 to 6 weeks, you can't have intercourse, you can't be lifting anything heavy over a gallon of milk. For some of those women out there, they're like, that's not negotiable. I
Not
mean,
going to happen.
I've got groceries, I've got things,
Yeah.
so they're like, I can't do that. And so now with this product, we are able to do it in the clinic. It just changes everything. So that's for stress incontinence. For urge incontinence, I mean, the technology has just been crazy in terms of what we can offer. So generally speaking, we do try patients on medicines. That's usually mandated by the insurance companies. So for urge incontinence, we talked about it's basically the bladder being kind of hyper. It's different than the support system. It's just the bladder being hyper. So the medicines are there to basically calm the bladder down. There are physical therapists who can work with the patient on just like, counting backwards from 10 and relaxing, because overall, though they feel like they have to go to the bathroom, most likely there's very small amounts of urine that are coming out because the bladder hasn't had time to fill. It's basically the bladder prank calling the brain saying, you got to go when you don't actually have to.
Right.
So we start with medications, then we can actually move on to some third line therapies if medications don't work, the side effects are too much. And those therapies are pretty exciting. So we have one where it's like basically an acupuncture needle we put into the ankle, and that essentially calms the bladder down through a series of treatments. We do apply Botox to the bladder. So same as the face, what I do is explain to everybody, Botox is a very powerful neurotoxin, which basically paralyzes muscle.
Right.
Hence why we always talk about, people with Botox not being able to wrinkle their forehead. We do the same thing in the bladder, which calms it down, obviously, by paralyzing it partially, not completely. And then actually we have something called sacral neuromodulation, which is been really the forefront of the innovative treatments right now, because before we would be able to offer a 5 to 7 year battery life for this device where we place a lead next to the sacral nerve. That's the nerve that controls the bladder and the bowel. But previously, we didn't have a rechargeable battery. So every 5 to 7 years, we would have to go in, change the battery out, kind of like a pacemaker. But now we have a rechargeable option. And so the battery life is 15 to 20 years. So for some people, that's a one and done kind of thing. For others, it's a one-time change. But it's all very, very exciting.
Well, that's awesome to hear. I'm sure that if somebody hears that, that's been thinking, I'm sure they've been thinking what you just explained. So that's great information. So what's the best or the most efficient way for a potential patient that may have heard what you were saying to reach out and connect with you specifically?
Yeah, absolutely. I would say go to our website. They're very easy to look up physicians, and they'll have our office number there. And just give us a call and let us know what it is that you're hoping to have a consultation for, and we'll get you fit right in.
Yeah, and I think I just put the website up for those who aren't sure. It's pretty simple. It's orlandohealth.com. It's great. Well, those are great pieces of information. And I think, what rang out to me when you were speaking was, and I'm not on the shot, of course, right now. Boom, there I am. What rang out to me was that when you said quality of life. That has to be, a major concern when you see a patient come in, a new patient. Obviously you're saying, how could you have dealt with this long? Again, the strength of what ladies can put up with is pretty amazing sometimes. So, is there anything that we didn't talk about that you'd really want to make sure that you get out to somebody out there?
Absolutely. So I'm glad you kind of reiterated that quality of life. For my urge incontinence patients, literature has shown that a third of those patients actually suffer from fecal incontinence as well. And that certainly is something that most patients don't feel comfortable coming forward to providers about. However, when they do, and when I've seen them in the office, um, you know, I realize, and I think they do at that point too, how much their life has changed because they have rearranged everything due to their fecal incontinence. So really, a lot of my patients at that point rarely leave the house. They're just too embarrassed to do so. And I would just encourage all of those patients out there who may be listening. We do have ways to treat this. The neuromodulation device that I had discussed earlier is actually indicated for fecal incontinence as well, with very good success rates. Um, and when I am able to fix somebody's fecal incontinence, I mean, it completely changes their life. I mean, they're able to live a normal life again, hang out with friends, see their grandkids, do the things that they've always wanted to do and didn't realize that they weren't doing for so long.
That's perfectly said. Again, when you were saying all that, what hit me was how specialized your practice is, but how it overwhelmingly is applicable to so many people. I just can't even imagine how many people have just put up with things for so long, and because of honestly providers like yourself and just progress in healthcare, in medicine, so much better life qualities out there now. So we thank you so much.
By not buying pads anymore. That's something that my patients are always like, "Oh my God, you have no idea how much money I spent on pads."
I'm only assuming on that one. It's a big deal, especially during COVID. I think some of those prices may have gone up a tad.
Right.
Well, I appreciate that you would be here today. And like I said, I know you're very busy, great information and highly accessible. I mean, great hospital. We're very, very fortunate to be able to have healthcare providers from Orlando Health speak with us. And so again, tonight especially, so we thank you.
Thank you so much for having me.
You got it. All right. Again, we're with Dr. Esther Han, urologist at Orlando Health, Dr. P. Phillips Hospital, subspecializing in female pelvic medicine and reconstructive surgery. That is a mouthful, but I pulled it off. I pulled it on.
Over.
We really appreciate you very much.
Thank you so much.
Again, this is Keith with Positively Osceola, along with Dr. Esther Han. Together, we're making a positive difference in and around Osceola County. Thank you.